welcome back to the Progressive Rehab and Strength Podcast. I'm your host, Dr. Rori Alter, here with my lovely co-host, Dr. Alyssa Haveson, and Dr. John Petrizzo. If I could say our last name correctly. Well, I don't use the last name, but he does, and so does my kid. But anyway, we are here again with another 10-minute Tip Tuesday, and we're going to be talking about the effect of the back angle and hip angle on hip pain in the squat and the deadlift. So typically we see the back angle or the hip be more affected by the squat. But there is some element of hip pain in the deadlift as well. So John, why don't you talk to us about how the back and hip angle affect the typical types of pains in the hip that we see with barbell training, which are commonly associated with arthritis and femoral acetabular impingement syndrome.
Sure. So these two things are related. And when you're talking about back angle, you're talking about essentially the angle that gets created between the torso and the floor. And when we're talking about hip angle, you're talking about the angle that's created between the torso and the femur. Just so everybody knows what Rory's referencing. And because the torso is involved in both of those, torso position is going to have an effect on the hip joint. So when we're talking about exercises that may be irritating for people, or positions that may be irritating for people with femoral acetabular impingement or maybe osteoarthritis, generally things that we move into a more closed hip angle are going to cause more discomfort. So a more horizontal back angle will lead to a more closed hip angle. So if we were talking about, let's say, the squat, a low bar back squat is going to utilize a more horizontal back angle, and therefore is going to have a more closed hip angle, right? So if you're somebody that maybe has femoral acetabular impingement, you may find that bottom position to be uncomfortable because of how acute the angle becomes at the hip. So a lot of people, that I've worked with who have had that sort of hip pain, typically respond better to a more open hip angle. Something like a front squat, would be the opposite end of the spectrum, where the torso is very upright and therefore the hip angle is more open in the bottom position. And that doesn't mean that they can't progress back to low bar squatting, but it just means that you have to kind of desensitize yourself to that position over time. And usually I'll run them through front squats for a while, and then maybe high bar squats, and then progress back to low bar squats and see how they tolerate it. So just to answer your question, the two are always going to be interrelated.
Well, I know the answer for me, but have you found that everyone with this type of with impingement syndrome or with hip pain feels better with a more open hip angle and more upright back angle? Or
No, not necessarily. Pain, like you guys have talked about on the podcast before, is multifactorial. Not all impingements are the same, right? So there's a lot more that goes into it. So you can't just use that as a blanket type of statement. Um, so I would say you just have to evaluate the person you're working with and what their symptoms are like, and see what they respond better to.
yeah. Um, this is kind of more related to the hip position, not necessarily the hip angle, but how does stance affect the hip, and what can someone do when they have hip pain and it's not back position related? Like they
Mhm.
can't find a better, like a comfortable back angle. What can they
Right.
do with their stance to help their hip?
So again, that's going to vary a little bit from person to person. What one person might be comfortable with, and so we've talked about like angle of torsion, right, and antiversion and retroversion, and these sorts of things that are going to impact like what stance is going to have is going to be more comfortable for someone, right? But certainly, like if you use a wider or more toes out sort of stance, that's going to facilitate more external rotation and abduction in your squat, right?
Hmm.
So in the hip joint, if you use a more narrow toes forward stance, that's going to facilitate probably a little bit more internal rotation and adduction, movement in the squat at the hip joint. So it really depends on where the person is most comfortable, but um, and you just have to experiment a little bit to see what works best for the particular person that you're working with.
Yeah, and I think that's like the really important thing is that you just have to experiment because not everybody's impingement are like actually it's not everybody's is the same. It's literally no one's is the same. You know, people develop their osteophytes in different areas. People have labrum tears associated with their hip, their FAI. People have their arthritis, develop their joint spaces narrowed, and and the muscles are all responding in a different way for every individual. So it's really not a one size fits all recommendation, but the way that the back affects the hip is that you'll get a more closed hip angle when your back angle is more horizontal, and you'll get a more open hip angle when your torso is more vertical. So you can play around with your back angle to affect your hip and make your training a little bit more comfortable if you are experiencing symptoms in your hip. Anything you want to add, Alyssa?
I
No,
agree with everything you've said. I don't have anything.
I feel like this was such a quick
Well,
10-minute tip.
one thing I will say, so when you're talking about playing around with back angle, really, then
It's bar
it comes down to
position.
load placement, right? So
Hmm.
if you're doing a low bar squat, the placement of the load is going to dictate the back angle, right? Because in order to stay balanced with the load in that position, you're going to be more horizontal. So I don't want people to get the idea it's like, well, just keep doing what you're doing in terms of load placement, and then just try and stay more upright. That doesn't really work so well, right? You would have to make a huge adjustment in your stance to like change the back angle, and not have to change the bar placement. So bar placement is going to dictate your back angle. So you're going to have to play around with that if you want to have an impact on the back angle that you're getting in the bottom of the squat.
Yeah, I feel like Alyssa's kind of think I see her cogs turning, kind of like if you have your bar way too low and you're squatting very up, like what are you doing? Is your back angle responding appropriately to your bar position or your load position? Alyssa, do you want to touch on that?
Yeah, I was just going to say that it's where the bar is probably the most important like first step, because once we
Yeah.
decide we're going to change something, it's like are we moving from low bar to high bar? And like you said, we can't just stay more upright with a low bar placement, because then we'll have an issue with the bar path and efficiency of the movement and
Right,
run into other
balance. Yeah.
potential problems. Yeah.
Hmm. Yeah. So, and then, we see people who are have their bars super, super low and then don't even stand upright all the way. And that can affect your hip by never extending your hip all the way, because you can't, because the bar is going to slide off your back. But that could be a whole other. Oh, that we'll get
Yeah,
to when we get to
that's
the
kind of
shoulder.
an interesting topic, right? Certainly, I think over the years we've all seen people that um, have a little bit of either low back pain or hip pain because of the fact that they never fully stand up in the squat, and they
Hmm.
don't even realize that, right? And once
Hmm.
once you kind of clean that up and you get them standing up fully, their discomfort goes away. So that's kind of a interesting separate topic, I would say.
Yeah, and that usually is associated with the person having the bar way too low on their
Yeah,
back.
for
I
sure.
typically don't see that with someone who has the bar in the right position or does a high bar squat,
Yeah,
um, because the the staying bent over is a protective response to keeping the bar over the middle of the foot, because if you stood up all the way when the bar is too low on your back, then the bar is either going to slip or it becomes in a position that's behind the midfoot. So,
yeah.
um, but
And
yeah.
it's gonna slip because of the fact that your torso is like not able to support it, right? So all the
Hmm.
load would be, basically on the hands and transmitted through the arms, right? It's not a good position to be in.
Oh
You
my
want the
God. I
load
can't wait
supported
till
by
we
the
get to,
torso.
I can't wait till we get to our shoulder month, and we should, Alyssa, when we get off this podcast, we should make a note this is a hot topic in shoulder issues, back issues, all those kinds of things, but super low bar is no good. But I think that's kind of it for this little 10-minute tip that I don't know if your timer went off or not, John, but
We have 25 seconds, so this will be
well
the
then.
first 10-minute tip ever that actually was 10 minutes.
No,
So
we've kept it under 10 minutes before, but not when you were
Maybe
here.
maybe
I don't think
once.
so.
Anyway, so back angle and hip angle, you got to play around with what feels best for your hip, but we just wanted to touch on how the back angle affects the hip angle and what your torso looks like. So timer went off. Look at that. If you have questions or need help with your technique, join us in the free Facebook group, The Secret Society of Barbell Mastery, where we do form checks on Wednesdays and Fridays. We do free Q&As in there that are live Q&As in there, as well as you can book a free consultation with any of the clinical coaches here at Progressive Rehab and Strength, and we will have the links for that in the show notes. Thank you again, John and Alyssa, and we'll see you guys next time. Bye for now.